Live better, live balanced. Avera.
It's been just over 2 weeks since the Centers for Disease Control issued recommendations to healthcare providers asking that children ages 5 to 11 get vaccinated against COVID-19. As a result, healthcare providers statewide are urging parents to bring their children in for the shot. That includes our next guest. Dr. David Basil is an Avera health pediatrician and Vice President of Clinic Quality for the Avera Medical Group. He's joining us today to answer some of the common questions parents have about getting their children vaccinated against the COVID virus and tell us more about who can and who should get vaccinated now. Welcome.
Thank you for having me.
This is a topic that I have been really excited to talk to you about. I have one child that already was vaccinated because she's over that 12, one that falls in this 5 to 11 group, and then one that falls under it. And I think a lot of parents out there have a lot of questions about when and where they should get vaccinated and really the difference between side effects from the vaccine and actual COVID.
Yeah, that's a great topic, and I'm kind of right there with you. I've got two that are already over 12 that got vaccinated earlier on, but I have one in that 5 to 12 range that we just got vaccinated a week and a half ago.
So let's talk a little bit about COVID in children, specifically that 5 to 11 age group and how the actual illness is affecting that age group.
Yeah, so that's one of the big questions that we get is that, well, you know, it doesn't really affect that age group that much, right? Well, you know, that was somewhat true last year, but this year, you know, the Delta variant's a whole different beast, and we're seeing it affect a lot younger age groups than we saw last year. And I saw, looking at the numbers, we admitted a 1-year-old this week, and that's not uncommon, whereas last year that was distinctly uncommon. And so we are seeing it hit younger age groups more severe. We lost somebody in their 20s last week type of thing, you know, so we're seeing it hit those younger age groups. And even if you don't get, you know, hospitalization from this in those younger age groups, it seems something about COVID, you know, can have some long-term effects that a lot of other illnesses we haven't seen. I've got a lot of, you know, high school, college athletes that, you know, got COVID and they're still not back to their prior level of performance. You know, it affects blood vessels and the lungs, and, you know, even if you don't get incredibly sick with it, it can have some long-lasting effects in those younger age groups.
So some of us parents that maybe had a little bit of a sense of security last year as we didn't see a huge impact to smaller children, that's not something we should be feeling right now.
Yeah, unfortunately that's not the case, and it is affecting, even, you know, aside from the fact that that's where a lot of it's being spread right now, the impact on that individual child is still more significant than you think.
What if I am worried about the side effects of the vaccine itself?
So the good news is that these younger age group, these 5 to 11, are actually tolerating the vaccine generally better than the older adolescents and adults. They're having less of the reactive symptoms, you know, less pain at the injection site and less chills and achiness and stuff. And that's not surprising because those younger kids tend to tolerate vaccines better in general anyway. But it's about half the symptoms is what the adults get. So they're tolerating the vaccine quite well. And the safety events, you know, things like myocarditis that maybe we worry a little bit about in those older age groups tend to be a lot less common in the younger age groups. And in fact, you're likely to see more myocarditis, say, from actually getting COVID than you are from the vaccine anyway. And so does the vaccine have some very, very rare effects, you know, allergic response, something like that? Yeah, it certainly can, but, you know, compare a very low risk of that to, you know, pretty sizable risk still of the COVID infection itself, and it's pretty clear.
We might see some sensationalized stories out there sometimes about somebody got vaccinated and then this terrible thing happened, right? But
right.
What I'm hearing is it's happening far, far, far more often in kids who just get COVID.
Yeah. For every story that you give me, you know, of somebody having something with the vaccine at any age, I can give you 10, 100, 1,000 cases of stories of somebody getting COVID and having something even worse happen to them.
Let's talk about the process of getting a child vaccinated who's in that 5 to 11 group and what that looks like. Is it a little different than an adult?
So the process is pretty similar. It is a slightly different vaccine, so it's a third of the dose of the adult vaccine. And the reason that is they studied a third, 2/3 and a full dose, and they saw the same antibody response to all three. So it's like, well, let's use a third of the dose, give it to 3 times as many people. So it is a smaller dose in those younger age groups and a slightly different buffer, which makes it last longer in the refrigerator so that we can keep it a little bit longer. But the process is pretty much the same. And so the process is to go to vaccines.gov, and that way then you can click down to your area and find out specifically in your community who is vaccinating and who's vaccinating children, and that's probably the easiest way to figure out where to go.
And it's still 2 shots?
Yes.
How far apart?
Still 2 shots, still at least 3 weeks apart. So like my daughter got it, and her 3 weeks would be on Thanksgiving Day. So actually not going to happen on Thanksgiving Day. So we'll get it, a few days later. So at least 3 weeks apart.
So that's interesting. At least, and there we see her too, at least 3 weeks apart. So I think I've been hearing it as just simply 3 weeks, or for the older kids, 2 weeks, but at least. Yeah.
So the reason why we do 3 weeks is that that's what it was studied at, and we know that it's effective at that 3-week time period. And, for like my daughter, if I put it off a week to 4 weeks, that's just one more week that she's not fully vaccinated and potentially at risk. So ideally it is 3 weeks, but, a day or two after that's not going to be the end of the world.
And if somebody's watching right now, even with a child maybe in that 12 and older who's been vaccinated, but they didn't get the second shot yet, if it's been a while, still go do it?
Yeah. And so we've had cases where people either were sick for some other reason or something and didn't get that shot. And it's still very effective to get that second shot later. You just have that time period between 3 weeks and now that you weren't protected. But it'll still be quite effective to get your second shot a little bit later.
And as we've seen the Delta variant and other variants come in, and we know that they continue to mutate when they have hosts, right? So how does getting children vaccinated play into ending a pandemic or making sure we don't have more variants?
Right. So what happens with the variants is the more cases you have, everybody that's got that infection is the risk of that infection mutating in them and then them starting to pass it on to other people. So the fewer people we have infected, the less chance we're going to see, epsilon or whatever the next variant's going to be.
Right. So at the end of the day, we're better off protecting our own kids, obviously, from COVID, but it's also going to help keep this from expanding or spreading through the schools. So Thank you so much for coming and helping us understand the vaccine a little bit more.
As always, thank you for getting the word out and helping us try to get past this.
COVID-19 vaccines are safe and effective. Get the full series of doses to ensure you are fully protected. If you or your children haven't been vaccinated yet, you can find out more through Avera Health's COVID-19 resources online at avera.org/COVID-19.